Gavel?
There we go.
What? Is there a gavel?
No,
Okay.
there's no gavel.
Wow. Okay.
We're in 2022.
Okay. Gavel coverage. We'll just. Okay. So, what time do we have now? We have 7 o'clock, right on time. So I'd like to call this meeting to order for the Redondo Beach Public Safety Commission at 7 p.m. And let's begin. Let's see what we have here. This works. May I have a roll call, please?
Roll call. Commissioner Hannon is absent. Commissioner Koenig is absent. Commissioner Marinelli.
Present.
Commissioner Gupta.
Present.
Commissioner Gall.
Present.
Commissioner Kleinbaum.
Here.
And Commissioner Gittens.
Present.
Roll call is complete.
All right, great. Thank you, Officer Lofstrom. Let's proceed to saluting the flag. Okay. Ready? Begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Let's go to item D, approving the order of agenda. Anybody want to make a motion to approve the agenda?
I make the motion to approve the agenda.
I second.
And roll call vote. Motion by Kleinbaum, seconded by, that was Commissioner Gupta, correct?
Yeah.
Commissioner Marinelli.
Aye.
Commissioner Gupta.
Aye.
Commissioner Gall.
Aye.
Commissioner Kleinbaum.
Aye.
And Commissioner Gittens.
Aye.
So approved.
Thank you. And then Officer Lostrom, do we have any blue folder items, either E or E1?
No blue folder items.
Thank you. And then item F is the consent calendar, if I can read the boilerplate here. Business items, except for those formally noticed for public hearing or discussion, are assigned to the consent calendar. The commission members may request that any consent calendar item be removed, discussed, and acted upon separately. Items removed from the consent calendar will be taken up under the excluded consent calendar section below. Those items remaining on the consent calendar will be approved in one motion following oral communications. May I hear a motion to approve the consent calendar?
I move to approve the consent calendar.
I second the motion.
Roll call vote on the motion. Commissioner Marinelli.
Aye.
Commissioner Gupta.
Agree.
Commissioner Gall.
Agree.
Commissioner Kleinbaum.
Aye.
And Commissioner Gittens.
Aye. Aye.
Okay, so the consent calendar, the affidavit of posting and minutes are so approved.
Thank you. Great. Would I go to F1 or would I go to F2 for approval?
G.
To G, thank you. Excluded consent calendar items.
None.
None, okay. And then H is additional boilerplate, public participation on non-agenda items. This section is intended to provide members of the public with the opportunity to comment on any subject that does not appear on this agenda for action. This section is limited to 30 minutes. Each speaker will be afforded 3 minutes to address the commission. Each speaker will be permitted to speak only once. Written requests, if any, will be considered first under this section. Do any members of the public wish to speak?
No speaker requests. There's 0 e-comments. And give me 1 second while I determine Zoom attendees. And no Zoom attendees.
Thank you. Great. Let's go to letter I, items continued from previous agendas.
Nothing on the agenda under that.
Great, thank you. So let's go to item J, items for discussion prior to action. There's J1, the panelist discussion. And I just wanted to say thank you, LAHSA, PATH, and also Max, I got your email, and it's a pleasure to have everybody here. But I would be delighted, we would be delighted to hear any presentations you might have, and I'll pass the microphone over to Kyle.
First up on our panelist discussion is going to be PATH. And I believe there we go.
Awesome.
You may approach the lectern.
Hi.
Good afternoon. My name is Courtney Reed. I'm the Associate Director for Spot 8 Services for PATH. I don't have a presentation, but I can go down like the list of what we do. We're here in Redondo 3 times a week. We're at the meal programs. PATH, we're People Assisting the Homeless, so we're a statewide homeless organization. And so we are contracted here. I oversee our outreach team through the South Bay Council of City of Governments. And so we are here in the city of Redondo providing services at the meal programs. So that's St. James, St. Andrews, and Shared Bread. We are trying to connect people to the services that's available. So we have rapid housing, we have interim shelter that we can, put referrals in for people that are interested. The main goal is connecting people to a permanent housing resource. So we have a team of 6, but we have 2 of them that come out here to the meal programs. We're also involved in homeless court with Joy. We're consistently getting people and graduating people through that with the goal of connecting them to whatever it is the judge has identified for them to do as far as, obtaining identification, connecting to mental health services, things like that. So that is what we do here in the city. We're throughout Spot 8 in the South Bay. And if you have any questions, then we have like a different expectation of how this would go. But if you have any questions, we can, we're here to answer those for you, so.
Sure.
How do you get referrals for people to use your services?
Oh, yeah, great question. So a couple of ways. So we're at the meal program, so people come to us, but there's also LA Hop, which is a website where people can input, like if you see someone on the streets experiencing homelessness, you can go to this website, and essentially that will, call out an outreach team, deploy an outreach team for people to get connected to. So we get the LA Hops from Harbor Interfaith. Max, our outreach, well, he switched. He switched positions now. But they had an outreach opening, so he's been filling in for the coordination part of it. So we get those LA Hops from him because they know Harbor Interfaith is the lead in Spot 8, so they know like what teams cover what cities. And so we are one of the cities, and so we will get LA Hop requests from, all throughout the SPA. So you go on that website, you type in as much detail as possible about the person that you see that's experiencing homelessness, and then we'll go out and try to make contact with that person. And we have like 3 days to try to make contact. Most of the time, we try to go the same day, if not the next day, to make contact, because sometimes they're not always in that spot when people do the request. So, and then we keep trying to look for that person, and then we'll put updates in the system to, let folks know.
Sorry, do you think the community has like a lot of awareness of this website or no?
It's hit and miss. I think that Harbor Interfaith would be a better fit to answer that question because they get the request. But I think, a lot of people know about it in some cities and some people don't know about it in other cities. But here in Redondo, I can't really speak to it because we don't get that many requests from Redondo. So
Question. So what are some of like the challenges you've seen in just the food distribution program throughout the city?
challenges from the main thing for us is connecting people to services, like if there's shelter, getting a shelter that day. If people want to go in somewhere that day, that's like the biggest challenge. We are engaging folks, trying to connect them, but there's nothing that's like, immediate. And you all have the tiny home village here, the shelter pallets, and, that's even a wait list. So if we have people that are here in the city, that want to get over there to try to get somewhere stable, to work on a longer-term housing plan, then that, they're just on the wait list. So you will see people here on the streets, but, we are working with them, but there's just nowhere for them to physically go because of shelter availability.
What's the typical turnaround time for shelter if someone wants to get in somewhere in the county and they're willing to move for it?
Well, I mean, that's tough because there might be a bed available, but it's not like in a close area.
Yeah.
And so people aren't comfortable going to downtown Los Angeles, for a shelter bed when they've been maybe, more on this side of town.
Sure.
So, yeah.
Do you think we could figure out some way the awareness in Redondo, and perhaps that could be an intervention, perhaps like going to the council and asking, to publicize the website more, because it seems like an excellent resource. And thank you for all the, great work you're doing. But if we could see somebody and then, anyone from the public could, connect them to resources to the site, I think that would be good. I had never heard of the website. I just remember one situation, we saw someone who was suffering from homelessness at our park, and the only thing we could think of, someone was passed out to call the cops. But if like there's an immediate connection to social services, that'd be amazing.
Yeah, I mean, the thing about LA Hop too is it, if you see someone in the park passed out, then the best is probably to
that's
call
different.
911.
Yeah, that's a different
Yeah,
situation.
so we do have a turnaround time of, 3 days, but, if we're in the city, we get them, as they come in. If we're in the city or close, then we'll try to come over that day. Because like I said, people, start out in one place and then, end up somewhere else. So it could be hard to find them.
I was thinking out loud here, Officer Lostrom and Courtney, but you have your police marketing tool that you have, watch your speed and so forth. You could say, something about LA Hop on that perhaps, or somehow, and I never seem to get a clear answer as how to use that channel 3 to maybe market LA Hop so that people watching the council meetings will know how to report something that's going on, because yeah, you're doing a great job. I just wish everybody in town knew about the right channel, because most people will just call the police and there's not much, they can do, so they'll just kind of give up. But those are a couple of solutions that I think we all kind of thought of. So, any other questions? Go
I
ahead.
have a question. How do you promote your services?
Well, we are at the meal programs, and so people, the volunteers at the church usually will say, hey, Path is here, connect with them. Don at Shared Bread is really good about saying, hey, Courtney, come talk to this person. When I used to go to Shared Bread, there are other staff that go now, but hey, this person, come talk to them. So the staff and then people know us. We usually have our T-shirts on, so people know us, with the T-shirts, and they know that they can connect with us to get either, ID voucher, case management, whatever needs that they, identify to help them get off the streets.
And what do you think you identify as ways in which the city can probably better help you to on your team and staff to kind of help with maybe residual benefits to the homeless as we work to how they obviously provide them with shelter and care and obviously food beneficiary services? What are some of the things that you think the city can do to help assist that effort?
Yeah, I think, the shelter pallets are great, more of those, interim housing. A big thing right now is, the vouchers that are rolling out. People aren't able to use them in the city. And so it would be good if, if there was some building or something that can come where, people can utilize those vouchers, housings for those vouchers. People want it, people want to stay in Redondo. People, have connections to the city and they have a Redondo voucher in hand. And, I'm afraid, honestly, that some people might not be able to use that voucher here in Redondo because it's just nothing available. So, housing is always going to be my interim, and permanent affordable housing is always going to be my, solution.
I don't have a question for you, but I would like to say thank you as a parishioner at St. James. I know that they take great care and pride in working with you to make sure that the homeless are fed throughout the week. And it's an orderly system, and I think it's vastly improved from what it was. So thank you very much.
Oh, yes, you're welcome. No problem.
Are there a lot of housing, I mean, I know they're not, but like, are there options available like in other areas of LA if people are willing to move?
That's a challenge now. Larger picture from my outreach team or my street-based engagement team, we have rapid rehousing and recovery, and we have people that have, vouchers right now. And it's a struggle. It's, people, right now, a lot of people have the vouchers and it's competition now, right, with the landlords. This voucher has this incentive, this program has this agency has this incentive. And so we are, you have to get through a couple of layers, to actually get somebody successfully inside in a location where they like. And so we do have to get creative when we're, speaking with our participants about being more open-minded to other places outside of the area. What about a couple of bus rides away from Redondo? Things like that. Those types of conversations are, where we are right now. So, if you want to live in Los Angeles, the Spa 6 area, there's availability. A lot of people just don't want to live in that area though for, safety concerns and reasons, so.
I have a question. Can you tell us a little bit about the history of your organization?
Yes, Haley can, actually. I don't want to mess that part up.
Doing a great job.
Yeah, thanks for coming to speak to us.
Hi, my name is Haley Fusley. I'm the Senior Director of Programs at PATH, and we are a statewide agency, a little bit over 35 years in business now. We started off at a church in Westwood, and they thought, let's give this a shot for a few months and end the whole problem, and 35 years later, we're still doing it. So our largest hub is Los Angeles, and we have, I think, 9 shelters, interim housing now, and we also build housing. So we have a lot of different apartment complexes over the city. We also are in San Diego, Santa Barbara, Sacramento, and San Jose. And we serve individuals experiencing homelessness from the streets all the way into housing, and we stay with them in housing. And we also have prevention, so people don't fall into. All and mostly funded by LASA, who's here also to explain the larger system in the county. So it is very meaningful that we're at these faith-based meal programs, because that is how we started, and that is how most homeless agencies started, right there in this little community that you live in, and you want to help those individuals that you're seeing on a regular basis. We have a contract with Redondo Beach as well, and it has kind of grown and been molded in different ways. We have a great relationship with the police department, and that's where this kind of stemmed. We were going to be with the police department and take their referrals, but what they saw was the greater need for us to work with the faith-based meal programs. And then I believe they hired, or y'all hired, Lila, and so that takes care of that spot while we take care of the homeless at the meal programs.
How many employees overall?
We are getting up there. We are close to 800 in statewide.
Okay.
So we're a pretty large agency. Again, most of our funding here in Los Angeles comes from the Los Angeles Homeless Service Authority, and city contracts or council district contracts, or business improvement district contracts. We have an LAX contract. So there's a lot of pieces that come together in order to do the work.
Would you say with the work you're doing in Redondo Beach, you can see a reduction in the homeless issue? Or would you say there are some opportunities to innovate policymaking or resources, mobile feeding units, things like that to maybe more solve the problem and be more flexible with the resources and potentially reduce homelessness? Or is there anything that you need that the city could provide or the public could provide?
I think this city has tried everything, and I mean that in a really positive way.
Cool.
There's innovation, as in, let's try this out. If it doesn't work, no, you're like, we'll be okay. Let's try something else.
Right.
I think what would be great is if your partnering beach cities could come together to do something together so that it's not just all on your shoulders.
Are you talking about the 3 cities of the
Yes,
beaches, not
yes.
Beach Cities Health District, correct?
Correct.
I see.
So you have the pallet shelters.
Right.
And I think in knowing friends and family that live here in Redondo, it's a lot to ask of a community. It's going so well. But what about the next community? And it's a lot to keep asking of your community. And so, yes, we do need more pallet shelters, but we wouldn't want the burden to all be on Redondo Beach. What about the other beach cities that we can maybe work with to build something bigger or more permanent? Or landlords, constantly landlords. Landlords.
Great. Are there any other questions from the commission?
Are there any issues like with medical care? Is there, adequate medical care? Are there any free clinics in that? I haven't heard of any.
The Shared Bread has doctors that come on site, and we recently started partnering with Venice Family Clinic. They're moving to the South Bay.
Okay.
And so every other Thursday, they're at St. Andrews, so
And-
a doctor.
Mental Health America also has a nurse that outreaches with them. So if we would see a need, we could call them and they'll come out to the city and assist. We just, in the past few months, Venice Family Clinic. And so they're looking and learning in hopes to figure out how they can be more integrated in the system out here.
Is there any way to hook up with like Covered California for some of these people, people who suffer from homelessness?
I'm sorry.
Sorry, is there the exchanges, the insurance exchanges from Covered California?
When they go to get public benefits, they're linked to all that. When they're linked to the Venice Family or any clinic, they're then signed up for everything that they can possibly be signed up for.
Okay.
I just had a question, just in regards to how you collect data and understand, how, your constituents are aligned throughout the city, so you can better assist them and serve them.
I'm stealing all your info.
How do you,
There's a countywide database that we all enter into so that if someone is in Redondo Beach and then tomorrow they're in the city of Carson, everybody can see it and look, as well as if they should go to shelter downtown, that we know that they're there and that they entered in and that we could communicate. Everybody uses the same database.
gotcha, awesome.
Sorry, Colleen.
Thank you very much for your time, and go Path, and we'll go on to the next panelist if there's no other questions.
Thank you, ladies.
Thank
You're
you.
wonderful. Thank you.
Good evening. Thanks for having me. My name is Colleen Murphy. I'm the Associate Director of Unsheltered Strategies at LASA. I'm also a PATH alumni and actually was part of the work to bring PATH to the beach cities way back when. I'm aging myself, but it's wonderful to be back down here and to speak a little bit to this group. I thought today I could just spend a little bit of time to talk about the broader system and then open it up for a Q&A if that works for you all. Thank you. So as you can see, the work around homelessness is truly a partnership with LA County being such a large continuum of care. We are the size of a country. And so it requires a lot of agencies and a lot of partnership. Homelessness is complex. Though the needs of those we serve are complex, and it takes literally the village to do all this work. And so I'm really privileged to be here with two important partners, PATH and Harbor Interfaith, and there's many more. 5 years ago, when we started to create a more coordinated system of of homeless services, we did start with outreach. And so that was where we created the multidisciplinary team where it had medical care on the team. We created a coordinated system because a lot of times cities would do their own thing. And then, as you said, people bounced around and there was no way to track and no way to partner. And so we also created what was called an outreach coordinator, which we have yours here today. We created the data system, expanded it and improved upon it to make sure all service providers were using it. And not just for outreach, but for shelters, for permanent housing and other programs. So there's been really a work on not only just to look at things in silos, but about the whole continuum of services. So a lot of focus on improving and expanding the number of interim housing beds. Really applaud your community's work in that, but also permanent housing. We know that for every interim housing bed, we need 5 permanent housing beds to be able to have turnover of those beds. And what we're finding is people are getting stuck in interim housing. So we really have to look hard there. The other thing that I think is really important, and to answer one of the questions is what can we do, is how can we prevent homelessness? Actually, if you're on social media, LAHSA just released a really helpful video on what we call inflow, people becoming homeless, because we also know for every person we house, 2 more become homeless. So we really have to look upstream because the homeless system is doing really great work, but we are the Band-Aid. And so we have to look at systemic issues that lead to homelessness and prevent it upstream. And so that way, we can focus on those who fall through the safety nets. But right now we have so many gaps in our systems, whether it's the foster system, it's the justice system, whether it's just the affordable housing, that all those things lead to what we see on the streets today. And so the homeless system, through your partners here, have never done better work. And it may not look like it some days because of that inflow issue. And so it's one of the pieces that we really have to look at both. But really some amazing work that's happening in your community and in the broader system, because we know too, it is a regional problem. It is, and so we need to really have regional solutions, and I'm really proud to work with our partners. We created also LA HOP, the LA Homeless Outreach Portal. At that time, it was my baby. So really proud of it, that it's a resource for if you do see somebody of concern, that it's there. I think what's great about your community is you have robust outreach. So pretty much everyone experiencing homelessness is likely on the radar. So I think discussions around strategic use of LA HOP is really valuable. I think one thing is if there's somebody that you know, but you're worried about, something seems to have changed for that individual, you saw them over the weekend, that's a good use of it. Somebody new that isn't on your radar, or just something that kind of keeps you up at night, then that's a really good use of putting in that LA HOP. But I did want to drive you all to another resource too, that's called Get Help on LAHSA's, LAHSA.org's webpage also. And that has many resources to connect people experiencing homelessness. It has information on safe parking, has information on prevention, how to get families with minor children connected. So it has a bevy of information. But LA HOP also an important piece of the puzzle. And so just wanted to end with, the conversation around, the work around pallet shelters. I think any additional investments in interim housing, we have found that places where people can have their own door work really well. So again, a pallet shelter kind of thing works really well. Also, we've had really good success with Project Home Key. And so looking at that model too is really good. But I'll stop my presentation there and open up for questions. And thank you for having me.
Any questions? Go ahead.
Yeah, thank you. What are your kind of what you've seen over the years as far as transportation for homeless and using our public public safety systems to transport them either around the city or throughout the metropolitan area throughout LA?
Yeah, I think as we've seen more people become street-based homeless, transportation has often become a day shelter or night shelter option for people because we are limited in those types of day places for people to be. So I think also looking at where people can be, decompress, get connected to resources is really important too. PATH, our partners, do have actually a contract with Metro to do Metro outreach on key lines. But also, like we said, a lot of it is just using it for that shelter. So I think there's a lot of work too to figure out where people can go and get connected and have a warm, safe place to be.
Oh, go ahead.
So I think, thank you for the great work, and that's amazing that, LA Hop seems like such an amazing resource. I think just what you talked about preventing, homelessness or really, I think that's a really fascinating and interesting idea. I'm a physician, I work in the hospitals. I feel like that the medical system does see people who are possibly right on the verge. Do you guys work with the medical system in identifying not people who already are homeless, but ones who have that potential to?
I might let Max talk a little bit about the hospital liaison. Okay, so I'll put a pin in that one but there is some really interesting work around how to engage with the hospital system. That in itself is quite a large entity and that all has different data systems. So there's definitely some challenges, but we are piloting some work around that too, to figure out. There's also some work to help with some of the highest utilizers of county resources to try to get them endorsed through our partners, the Department of Health Services and Department of Mental Health, but a really important piece. And we know medical conditions are often the last straw to lead somebody from being precariously housed to permanently homeless. So, yeah, thank you.
Sorry, one more follow-up. So I also work for Optum, which does a lot of population-based health. And I'm wondering, do you partner with managed care organizations that does have a lot of this data? Because I manage a skilled care nursing facility. I work with our case managers a lot. And it seems like when we do have people, who suffer from homelessness, we don't have many options. There's like shelters and there's not really much else. But I don't know if they know as much of the resources that are actually available.
Yeah, I think one of the things is even if you knew the resources, they're scarce. So I think, a lot of the hospitals do have access to the Department of Health Services beds, but a lot of times they're not around the community. They're not open. We have been working this within a pandemic too. So a lot of our work has shifted into keeping people on the streets and in shelters safe from COVID. And again, I think that's a story we need to talk about, that we expected a humanitarian crisis on the streets with people dying of COVID, but because of the great work of the outreach teams, we were able to partner with healthcare workers to bring vaccines, testing, and all of that. But I think now that we're getting into a little bit more of an equilibrium, we can start looking again at the hospitals and how to really make some impact there.
A quick question would be, you said that your outreach services are on most of the metro lines, so that made me think of a couple questions. Where are you with presenting your services on the green line where Northrop Grumman is located? And then the other question is, what is the constraint or the obstacle that you might have in marketing more of your services on all the metro lines? And should we give Sheriff Villanueva a jingle on that one to help you out with that? Or what are your thoughts there?
We are currently on all the lines.
All the lines.
The ones that we're not on are the ones being under construction, or if there's a connection issue. You can call the sheriff if you'd like.
Sure.
I think it's a very, we do ride the metro, but most of our work is done on the
Platforms.
Platforms, thank you.
Okay.
And Metro also gives us offices at Union Station. We're currently talking to Long Beach Transit to see where they connect to us, and we're also talking to LAX when they have their new transit line.
That's exciting. Yeah, I'd like to see more riders on there just going to work and stuff. I think a lot of people it's kind of tough because a lot of transients use the metro lines to go everywhere, and it's kind of challenging in that regard. So
Yeah, I agree. Metro even put in some funding for shelter beds. It was quite expensive, but they weren't utilized. And so we had to kind of look at because you have to convince someone to go into a congregate site. So I think what Colleen was bringing up earlier is that the ones where you have your own space with a door are a lot more successful.
rather than like a barracks setup.
Yes, yes,
Copy that.
yes.
Are there any other questions?
Thank you.
Thank you very much.
Sure, I'll ask a quick question, and you didn't have to flee real quick. And before Harbor Interfaith speaks, I just wanted to ask, of the three of you, and I know that we have yet to hear your presentation, but what is it that you could use from us? I mean, between volunteers or funding, how could we become more vested and invested in this process and these programs? What do you need from Redondo Beach residents?
Thank you. I think there's a huge need for public education on why people become homeless. I think there's a lot of focus on the individual failure and not on the system failures. And so helping people understand what leads somebody to homelessness and some of those things, and then look at ways that your community can help prevent some of those things and support and invest in those. Affordable housing is one of the key. In LA County, we're 500,000 units short of affordable housing. So trying to do that, looking at your school systems, I think, the youth system and looking at at-risk children and what we can do to better support them and their families. And I think just those investments and, people being able to live that life that we all want to live. We all want to have good jobs, purpose, a roof over our head, and a sense of community. So whatever we can do. Also for those who have been homeless and become housed also is how can we integrate them back into our community and help them feel welcomed. But I think a lot of that comes with some understanding on and humanizing of the issue is really key. Landlords. So any events to incentivize people to rent to people, whether it's Section 8 or a rapid rehousing program. And again, that can seem a little challenging, but again, most people who experience homelessness are from the region. And so, how we can keep them in this region. Every community, LA is made up of 88 cities. They're all asking the same questions of, where. So I think if everybody says here, and like we said, we urge our neighbors to say here and do the prevention work, I think we would see a much different world in a few years when I come back.
It seems like what I'm hearing, I think we need some sort of campaign, basically to increase the empathy and decrease the fear. So there could be ideas, maybe having people who suffer from homelessness speak at different events or different venues or things like that. So, because that would provide the kind of the seeds that would allow some of these other policy things to go to, to be enacted.
Absolutely. And also jobs, a lot, it's really hard when you leave, when you've been justice involved, it's tough to get a job after you have that on your record, especially if it's a felony. And so how do we stop the cycle and get people back? And so I know there's a lot of interesting programs to try to get people back in the workforce. And how do you get good paying jobs? Because we know you can't live off minimum wage. So how can we have good, solid training programs that help people get those jobs that we desperately need? We're hiring too. So any work you can do to promote people joining homeless services too, to join this work, because every agency has needs. And so promoting young people as they get out of college to really think about our work. We need the best and the brightest.
Is there any vocational training or educational training involved for homeless people?
There are some programs that do it. I know Homeboy Industries is a big one that you've probably heard of. There's a group called Chrysalis that does it. There's smaller groups that do it, but I think doing some homegrown stuff is really helpful too, because I think we only have a few agencies that do it, and I think we definitely need more.
How about at the community college level? I mean, they talk about worker training and so forth, but has there been like at Harbor College or East LA College and so forth, a training program directed at folks who are recovering from homeless issues? Or is it more toward the student population age bracket?
Yeah, I'm not aware of any programs that are geared at the college level. Are my colleagues aware?
There are training programs to get into our field. And there are programs where we can send individuals that are willing to get jobs in order to get trained to get into our field as well.
How, no, maybe, for example, could be working on a ship field, for example. Maybe El Camino College has a training program for that, and maybe the homeless population, maybe there'd be a dozen people in this community that would be delighted to be trained on that. And have you partnered with, say, a dean at El Camino College or Harbor College to see what type of training programs they have for students and also workers or people who want to tool up on their skills and so forth?
Our partners at Chrysalis, that's their only job, is to connect individuals to employment.
What is Chrysalis?
Chrysalis is an employment opportunity agency, so
Okay.
when we house the homeless, they get them employed.
Do they have a branch? Do they work in Redondo as well?
No,
They
they
don't.
have offices in downtown, I think Pomona and Santa Monica.
Yeah.
But since COVID, they've done a lot online. And so what we can do is sit with an individual with our computer and then get them linked. And then if they get linked, we can provide all the transportation and even a laptop and all that kind of stuff.
Can we have them come to the meeting? Like, talk to
We
them?
probably could. I met one of the directors years ago, but I think as an action item, I think we have a healthcare alliance meeting that could be done here or offline, and then maybe a community college LAHSA meeting, whether it's here or offline. But I would be curious to see if that type of education and training for the homeless population might be a new, for lack of a better word, market opportunity.
Absolutely, and anything, we're always looking for people to join our mission to look at employment and things, because we tend to be service providers to connect people to the things, but having business people do these things who are experts in it is really great. And I think looking at the model of Chrysalis and Homeboys is definitely a great place to start.
Then maybe if you guys have resources like buildings or even things in the community where, I don't know, maybe where people can go and take classes or something, I don't know, creating like little, areas of education and vocational training and stuff in the
We would
community.
applaud all of that.
Yeah, also, I think maybe looking at the problem holistically as well. I think all commissioners may really have valid points, but also addressing one of the elephants in the room is substance abuse. And so just want to know how you all handle or kind of try to tackle that particular problem within the homeless community, and how maybe we can help to support any efforts there as well.
Yeah, I don't know if you saw the report that was released a few weeks ago about the rise in deaths due to substance use disorder. It was really quite alarming. We've been seeing it. All of our teams carry Narcan or naloxone and are trained in it. We also actually train the trainers, so we provide it to people experiencing homelessness themselves. So if they see somebody, because we're not there 24/7 to administer Narcan for an overdose. We have substance use disorder professionals on our multidisciplinary teams. All of our teams are trained in how to access the substance use hotline to try to get beds. And we're definitely trying to get more harm reduction services out into the community. I know also the multidisciplinary teams, because they have the medical component, will be doing even more of that. But the fentanyl out there is really, really challenging across whether you're experiencing homelessness or not. And the deaths due to fentanyl is just through the roof. So that's going to be a big piece to prevent the deaths on the streets and in our communities at large. I think some of those things we talked about to prevent homelessness will also prevent people from turning to substances. And prevention is a really cheaper way to start. So how can we stop people? I will say a lot of people may have an issue with substance use disorder, but go on the streets and then it gets worse because, you know, you may need uppers to stay up all night for safety issues and then need a downer to sleep during the day. And so you definitely see, and it's tough to be out there sober. So I think also, again, trying to get people, but we have what's called a housing first approach, where we don't ask people to be sober or not using substances, because we know it's really hard to quit anything, even in the best of circumstances. And so knowing that it's really tough to do it when you're on the street. So we want to bring people indoors, get them some stability, and then start talking about their goals, which, you know, may include substance use and trying to reduce and get them connected to those. But we don't have enough beds. We don't have enough detox beds. We don't have enough. So if somebody says today, I want to go in and detox, we scramble, and a lot of times we won't have the bed, or if it is, it's all the way up in the Antelope Valley. And again, that's too far. So that is a huge need. And I know there's a lot of work at the state to try to get more resources, but it's tough for communities to accept these type of facilities too. So I think again is you know, understanding that these type of treatment centers don't attract people experiencing homelessness, but it actually helps people get off the streets and get housed. So definitely need outweighs demand, but an important piece.
I have a question. What metrics do you have to see how well we're doing winning this war against homelessness besides counting the number of people staying overnight in the street?
Yeah, so the great thing about us all sharing the same database is that we are able to merge our numbers to see our successes. I think one thing you could do, again, it's reported regionally, but Measure H, a lot of this work is built upon the foundation of Measure H, and they release data quarterly on their website. If you look at the Homeless Initiative, their website, the quarterly reports, and it talks about how many people are housed, how many people are interim housed across all the homeless system that Measure H funds. I'm sure your PATH partners provide reports. So I think definitely looking at those to see how well they're doing. We also release something called the HIC, the Housing Inventory Count, where we also are checking about how many beds we have and how many people are in them. I will tell you, as somebody who has the privilege to serve the entire county, and I have to track beds, interim housing beds, you know, on any given night, there's not a lot of beds empty. So that means our system's working really well to get people in. But why we see rises in homelessness year after year these last few years is because of that inflow. So I think in the homeless count data that will be coming out soon, every year we try to unpack the progress made, so how many people we've housed permanently as well as people we've interim housed, but then how inflow, because we do a demographic survey on top of it to ask people. I remember 3 years ago, I was shocked when I saw the statistic that half of the people who are unsheltered have reported becoming homeless in that year. Half. We had never seen that. It used to be chronic homeless people have been out there for quite a while, but that's when we started to see the inflow. So I'm very eager to see, as I'm sure you are, the homeless count data to see where there's points of light. I think what we saw with Project Room Key and all the other investments, we'll see points of light. And I think it will be very interesting to see where we have these areas of struggle and how we can partner together. So I'll look forward to making sure you all have the homeless count data. It usually comes out in batches, first kind of the macro and spa level data, and then it takes a little time for HUD to sign off, and then we start to have the city by city data.
Does the city of Redondo Beach have access to view the same data and also update the data so that everybody else in the county and all the different agencies can access it and collaborate in updating the data?
The homeless count data?
Yes.
The homeless count data, when it's released, all cities get to see if they have questions.
Okay.
They can, we have a community engagement department that usually work with you to see anything, unpack it. We usually have a sheet with data, youth, women, men, unsheltered, sheltered for each city. So if you want to take a look at the 2020, it's on our website. I can send you the link just to get a sense of what those data look like. But yeah, great question.
Are there, sorry.
Chairman,
Go ahead.
Joy Edeking, I work in the city prosecutor's office. Hi, Colleen. The city of Redondo Beach recently hired our own housing navigator in January, and she does not have access to HMIS or CES. So we were wondering, how can the city become a partner with LAZA in terms of data sharing and getting her access to connecting her clients to HMIS and even putting them into the CES system so that they can get the resources they need. And when she permanently houses someone, they can be reported as permanently housed.
Yeah, great question. I know there's a lot of work happening right now on how to grant access to cities and what that looks like. That was part of the Blue Ribbon Commission recommendation. So I know there's a lot of work with our data management to be able to address that. But please contact me after this meeting and I can check in to see where that request lies.
Thank you.
You're welcome.
Are there campaigns to appeal to people who are at the risk of becoming homeless to, like if you are at risk of being homeless, access these resources? Are there campaigns focused on that right now?
I would say there's not campaigns because also the resources are probably not enough to address the need. So while we definitely do make sure key entities know it, people who are seeing those front doors, I think the challenge is if we did the billboards and the bus signs, it would be people, the need would be so great. So I think that's the balancing act. We're working in a famine environment where there's so much need. So while getting the word out there is part of the battle, the key piece is to make sure we have enough resource to prevent that. But I want to congratulate your city on all the great work you've been doing and your partnership and really applaud the work. And I really appreciate being here tonight.
Thanks for joining us.
Yeah, thank you.
Thank you.
Thank you for coming out. Thank you for being so selfless. Thank you for giving all of your time.
Yeah, it's a privilege. Thank you.
Hi, Max.
Hello, Commissioners, Chairperson. My name is Max Estrada. I'm the Regional Coordinator for the Coordinated Entry System here in Spot 8. Spot 8 runs from north of Inglewood to the south, throughout the South Bay, that leads into the city of Long Beach and covers all of Long Beach. And so I did bring some pamphlets regarding the LA Hop so we can provide you more information. Of course, you can find more information at lahop.org. I also brought some materials regarding the coordinated entry system here in Spot 8. And Harbor Interfaith, of course, as you all know, is the provider for the pallet shelter here in Redondo Beach, where there are 15 tiny homes that are dedicated to people experiencing homelessness in the city, where they can work on getting permanently housed, and working towards employment or educational goals as well. With our use of LA Hop, we, Harbor Interfaith, are the dispatcher for the Spa 8 area. So we work in coordination with all of our other nonprofit organizations as well as LASA. We work in conjunction, working together to serve so that we may be able to provide outreach services, and eventually we'll lead them to either bridge or interim housing as they work on permanent housing goals. And so there is a meeting that we have every Wednesday called the Care Coordination Meeting. We gather up with all the outreach workers and all the service providers or anybody that's working with homeless services, that we work together and identifying hotspots and collaborate on how we can all work together to serve that community or hotspot or encampment. And so we try to link all those individuals to services. So our organization started in 1987. And we also have an access center for the Spa 8 area in San Pedro, located at 599 West 9th Street. There's an access center where families, youth, and adults within the South Bay region can access homeless services either for prevention or homeless services. Are there any questions?
I'll start. You said there's 15 pallet shelters right now in North Redondo Beach. What would you say the current usage is, and how many homeless individuals have cycled through over the last year or so that they've been in the pallet system has been set up?
I believe the last count was more than 24 residents were placed into permanent housing. And that was, I believe, since the beginning of 2021, I believe. I could be mistaken. But working together, case managers were able to do an EHV, emergency housing referral, so they can obtain a Section 8 voucher. So they can start working on looking for housing, identifying landlords that would accept the vouchers, and also work outside of the Section 8 housing. We also have rapid housing, which is a time-limited subsidy. So within that time, yes. We really like to promote non-congregate setting. We do believe that most congregate settings cause more trauma. And especially when there's someone is going through an experience where you have to be really open and sharing your stories and be vulnerable and trusting that your case manager is going to do the right thing, that they have a setting where they are able to work on their mental health. And if they are working towards substance abuse treatment, that they have a space that's quiet and unique to them. And we like to promote that congregate setting. There's also from Project Home Key, where everybody was able to be in a motel room that had a chronic health condition. That way they're not getting exposed to COVID-19 and or getting severely ill. So we do like to promote those, but we know that it is more costly, but at the same time, we do see that there might be a more magnet for people to receive those services.
How much more is a non versus a congregate service? I know we talked about Metro and so forth having those type of arrangements, but is it like 2 to 3 times more per unit, per person, to have their own door and their own individual space? Any thoughts there? Or?
I wouldn't have the knowledge to provide you with that answer,
okay.
Unfortunately. But what more so is impactful is that person's development, being someone that's chronically homeless, that's on the street, working on their various issues versus seeing them transition throughout the time, having a roof over their head, a door that they can close,
Yeah.
and being able to work on their permanent housing, collecting their documents, their ID, their social, their birth certificate, their proof of income. Maybe they had no income at all. Maybe they had income years ago and now they have to work with their social security to get it back together. So it's just putting all the puzzles, pieces to, create a masterpiece with each person. And so we work one person at a time.
Sounds
working on
more
the-
efficient to have that closed door where they can kind of get their stuff together
Right.
and you don't get hassled by the other people in your unit.
Right, because, in congregate settings, there's theft,
Yeah,
there's harassment,
yes.
right? There might be somebody that they may owe money to or had issues with on the street and they no longer want to be there because they don't feel safe.
That sounds more like jail. Yeah, I understand. Are there any other questions, commissioners?
I have a question. So you said there was 24 people that got permanent housing from the
That's
shelters?
an estimated number, but
Yeah. How many people have actually lived in the shelters since inception? Just a rough idea, if you have that.
I would probably say any words somewhere in the 40s.
In the
Wow, that's
40s,
pretty
okay.
good.
Okay. So there's a significant percentage of the population that's lived in the shelters that has been able to get permanent housing. That's good.
Correct.
Thank you.
40 to 50%. Yeah, that is good.
When someone enters our pallet shelter program, is somebody from Harbor Interfaith there with them?
Yes, we do have a outreach worker that is dedicated to the city of Redondo Beach. They most likely will work to identify the person that will go into the shelter, and we'll work with them along the way as well. There is a case manager at the shelter that will help them with all of their housing need. That way the outreach worker can stay on the streets, connecting relationships and building rapport with people experiencing homelessness.
That's a great answer. Thanks for your hard work.
Thank you.
You mentioned vouchers. I think we've had a couple conversations about vouchers. What were some of the areas within just working with landlords on how to accept those vouchers and kind of where do you see the pockets of acceptance with landlords and working with them on the voucher program?
I think it's really hard because landlords may have a perception that they may not get paid and or not receive the security deposit in a timely manner faster than somebody that is earning 5 times what that person is making, and being able to have enough time and obtaining the documents, right? They have to provide a tax ID form. They have to provide proof of ownership, right? They have to, create a draft lease and or an executed lease, right? There's a lot of information that is going into it. And, if there was more incentives that were available for housing folks, which there are quite a bit of incentives already out there, but if there was a more incentive for landlords to engage and or if there were more permanent supportive housing allocated to the certain areas, it might also help. We try to strive to give payments to landlords as soon as possible, but, of course, there's a lot of paperwork involved.
What is the turnaround time versus somebody just saying, I'll just pull, $5,000 out of my bank account? Would it take you 30 to 90 days to do yours?
No, it won't take 30 to 90 days. It's quite faster through a nonprofit agency than it would housing authority, unless they get into that cycle of automatic payment. But if it's like a first-time landlord, it could take up to possibly 2 weeks before payment can go through, and landlords don't necessarily want to wait that pay period.
Wow, not even for a net 15. Okay, that's interesting.
So I think landlords want money when they sign that lease.
Right in
That would
advance of the first month.
also provide extra ways to get through that doors.
Are you able to provide an extra, like a cushion for the applicant, or, like a 1 month additional, or is
We
that?
are able to pay up to 2 times the rental amount,
Okay,
plus the first month's rent.
wow, okay, net 15. Okay, thank you. Are there any other questions?
Is there any insurance program like for the landowners?
So there is a program through Path Lisa, right, that is through the Housing Opportunities Partnership. And so they do have a program called Lisa through Path. And with that program, it will definitely offer, I think it's up to $10,000, right?
Is that LISA?
Path Lisa, like a sign you lease.
Okay, Path Lease Program. Got you. Okay. Are there,
It's a Path family night. I'm sorry, I'm Path alumni as well.
must be the right path. Okay. Any other questions, Commissioner Gupta? Get Marnelli? Okay. Thank you, Max, for your time. I think we had a record number of panelists and questions, at least over the past 4 years. And sorry to bore anybody, but this has been a really good presentation. And thank all
you.
of the
And I'll leave
groups.
these materials up here too.
Thank
if
you.
anybody wants.
Thanks for all your hard work, Max.
Yeah, thank you,
Thank you
Max.
for all your hard work. Thank you.
Learned so much.
Let's see what we have here. Before closing this out, do I have to ask for any comments from the public and so forth, or?
There's no public comment.
Okay, great,
Attendees or.
great. Motion to close the panelist discussion. Do I hear a motion to close?
I motion to close. Oh.
You can move on.
I can move on.
Yeah.
Thank you all.
Thank you to all of you. Thanks for your compassion.
Thank you.
Thank you.
Thank you very much.
Let's go on to J2, discussion of recent fire events. And I think I see Chief Yang there. Hello.
It's nice to see you in person.
Commissioners, how are you? Isaac Yang, Redondo Beach Fire Department Division Chief. Let me provide you a look back into the annual call volumes from 2020 till now, and then projecting into 2022. We'll go back, we'll talk about the first quarter call responses for the fire department, January, February, March of 2022. We'll look at some of the fire issues that have come up, and then we'll talk about some of the strategies the fire department's going to take as far as prevention and how that marries with the response component of kind of the cycle of what we do as far as the overhead broad stroke services. So in 2020, we ran 7,314 calls in total. In 2021, we broke 7,600. And this year, we are projected to go over 7,700. You can see that upward trend. That upward trend is statistically predictable based on even a 10-year look back with a couple outlier years where the annual call volume for that year was less than by a few hundred to the previous year. We can trend about a couple hundred calls a year on an increase, which in and of itself on the annual, if you're talking about like 200 calls a year, you're talking about maybe one call every couple days. But when you look back over the span of, I started in 2002, that year we ran 5,150 calls. This year we're scheduled to run over 7,700. So on an escalation of about 100 to 200 calls a year, as we continue to move forward, the trajectory of the call volume continues to deepen. So with that being said, I'll kind of round out the back end of our conversation tonight as far as a more preventative risk reduction component moving forward with the fire department with proactive efforts to drive the call volume down, which I think is kind of counterintuitive. When we talk about the fire department, like most people, whether in the industry or civilian, we hang our hats on how many calls we go on. But truly, if we're going to move forward as a contemporary progressive agency serving this community, we really have to look at seeking ways to really preserve a standard of living, a higher standard of living where people are doing well, people are out of harm's way, people are self-sufficient, and in turn, we're actually reducing the call volume. Now, can we quantify events that we prevent, thus improving that standard of living? Well, as we move forward, we'll see how this road kind of unfolds before us. This past quarter, we ran 646 calls in January. Of those 646 calls, 474 were medical in nature, and the balance were fire-based related. What I mean by that is non-medical, but hazardous situation. That would include wires down, vehicle accidents, vehicles into buildings, broken water main, sewage leaks, alarm bells ringing, things of that nature. In February, we ran 684 calls in total, and of those, 468 were medical in nature, and the balance were fire-related in terms of hazardous environments. And in the month of March, we ran 503 calls, of which 228 were medical. This is a bit of a obscure month statistically. In March, we opened up with the Mark 43 computer-aided dispatch. And so as an enhancement and a modernization of our computer-aided dispatch, there are also some reconciliations we're kind of working through to really kind of lock down the efficiencies of that program and how we're going to utilize that on the fire side. So I would anticipate that as we reconcile these report numbers, they'll see an increase in the call volume for medical. You can see in January and February, we had about a 70 to 75% call volume percentage in total for medical. I would anticipate as we bring March numbers into alignment, you'll see a reflection of that as well. If we talk about fire incidents in particular, and so I'm talking about incidents responded to, right? After the fact, the bells go off, the hazard is occurring. So in January, we ran 6 fire-based calls. And when I say those fire-based calls, there were products of combustion that negatively impacted the space, whether that be fire, thermal insult, smoke, things of that nature that create that hazardous environment. That's what we quantify as a fire response. So in the month of January 2022, we ran 6 fire-based emergencies that were evolved into a fire problem to result with thermal insult with flame, smoke, superheated gases, things of that nature. 2 of those responses were in the city of Hermosa as an auto aid resource deployment. 4 of those incidents occurred in the city of Redondo Beach. Those would include outdoor storage issues where there was a fire that occurred to the outside of a structure but caused damage to the outside portion. There was some elements of cooking that were in residential spaces for that month that created fire problems. There was one incident with heating, ventilation, and AC units that were commercially placed in, what was the location? In a retail space, so a non-residential space with an HVAC unit on top. And then there were also some common space fire issues, like in common hallways, in shared living spaces, apartment buildings, things of that nature. In the month of February, there were 2 in-town responses, ironically separate incidents, separate locations, overloaded fireplaces. So it was maybe a cooler time frame. It was both beginning and end of February. And it was folks that maybe out of ambition to warm their homes at a more rapid rate, they overloaded, whether it's too much wood, but there was also one element where there was paper placed in the fireplace. So certainly if you were to ever light paper on fire, it conflagrates very rapidly. And then in so doing, it starts to drift and float. So it doesn't necessarily go up the flue per se. And so that created an issue in that residential space. In the month of March, we had 3 responses, fire-based. One was, 2 were cooking-based in retail spaces, meaning restaurant spaces, and there was electrical utility issues in a residential space. So If you look into the physical spaces, the addresses, anecdotal on a look back through the course of my career, I would say that more oftentimes they're in residential spaces as opposed to commercial spaces. But if you're looking at the statistics on the queries that we ran for the first quarter, of the 11 incidents that I just mentioned, 3 were in commercial spaces. The balance ran residential. So those things being said, it kind of gives us a template of what to strategize, a way to approach the fire problem in terms of education, to be able to provide access to information, data, resources to help educate the population in totality. Certainly we need to reach out to folks, just general population, residential space. We want good storage. We want good diligence in the cooking space, obviously. And then for the sake of everyone's general awareness, like how we're utilizing some of our residential spaces, our fireplaces, our utilities, our electrical, and being able to responsibly manage those benefits to the services that we have through the utility companies and just kind of residential components of our homes. We talk about the fire prevention program and being able to reach out to businesses, really as we move forward into inspections of the residential spaces as they're mandated by the state. We really do exterior spaces of shared living spaces, not single family dwellings. And we don't go into the spaces, right? We do exterior evaluations of storage, of access, of address numbers, things of that nature where we can kind of ensure code safety as it's indicated by the California Fire Code. We have 3 out of 11 fire issues in the first quarter in commercial spaces. Those are the spaces that we actually make access into. We're able to educate business owners. We're able to give recommendations on best practices. We talk about storage. We talk about ignition sources. We talk about things of that nature. We talk about utility control, electrical panels, extension cords, things of that nature. So reflective of that education and inspection code enforcement component, the reflection of those efforts are seen just even in the data that I have in my hand, right? So of the fire issues that we have the first quarter, the lesser component of those spaces is a commercial space. So we want to be able to pursue and find ways to access residential space education in addition to that code enforcement piece. So certainly we're going to work towards that. We do have the production of more training availability that we'll be placing on our website, on the city website with the fire department and the fire prevention page, to be able to allow residents to be able to contact the fire department for training, whether it's a shared space, townhouse complex, single family residence, apartment buildings. And so those are some of the things we're doing in terms of identifying a fire problem, identifying a group that we want to be able to pursue for education to reduce the fire hazard as we move forward into 2022 and beyond. There is, like I said before, there's the response component that we always kind of assimilate with the fire department, but there's also the cause and origin, and then identifying how these are occurring, but then wrapping around to like the prevention education piece. And to really kind of in line with our partners here that we just talked to be able to prevent, to improve a standard of living is really kind of what we're pursuing. So with that being said, we just talked about the fire site education piece to reduce that hazard and frequency, but there's also, as we mentioned here, we have the homelessness issue, we have the mental wellness issue, we have different age groups that we're pursuing. I'd like to let you know that we're very excited for the mental health and wellness component, education, resource, training component. On May 25th, we're going to partner with Beach Cities Health District and access the older adult population. May 25th, we'll be at Casa de los Amigos with our first ever Wellness Wednesday program. So fire department will be out there with our support canines over at Casa de los Amigos from 9 to 11. We'll take vital signs, we'll help the population there with their medication, reconciliation. We're gonna help them fill out what's called an envelope of life. And that is basically pre-registering history allergies, medications that the patients may have in that complex, being able to get information as far as contacts, and having that in their units. So when we go and we make responses, we save time on the back end, because on the front end, we're getting that data, and we can expedite treatment and transport and sending folks to the appropriate facility. In addition to that, we'll also be partnering again with Beach Cities Health District. They will be sponsoring an 11 to 12 yoga tai chi class. So in addition to preparatory with the fire department, vital signs, support canine wellness, interaction and outreach, we'll also top it off with some physical fitness for that group. The goal is to be able to access all the senior living complexes, of which there's 7 in the city that we're pursuing, and then the 3 the senior centers in the city. And we're really going to pursue being able to reach out, educate, and provide services for these folks on the front end. We're also working with Beach Cities Health District to work with the school district for our school age and high school kids. There's a lot of things that we're working currently and into the future to be a more well-rounded, not only response, but prevention, wellness, proactive agency, again, to create a healthier group in the community, whether it's the young children, the working adult, and the older adults. So that's where we are with the fire department. We had a great event on May 7th, Fire Service Day. About 1,000 residents came out, fire stations 1 and 2, family age, school age kids, young families, older families, all kinds of folks, neighbors came out. And obviously the Beach Life Festival we had over the weekend was a great event. We had firefighters there, not only working the event as a public safety component committed to the community there, we also had fire department members on duty with the trucks, engines, rescues, support canines, interacting with the community. So those are all pursuits that we're doing right now, and we'll certainly commit to continuing to do in the future. Take any questions as you may have.
I have a question.
Sure.
You mentioned some statistics about the number of calls the fire department has over the years and how it's changed. The population of the city has also increased over the years, and also the number of structures.
Yes, sir.
How well does the number of calls correlate with the change in structures and change in population?
Sure. So even as that's reflective of the call volumes as the escalation continues to grow through the course of the years as we kind of pass through time. So I believe that as the population density increases and as the structure count increases, also, in addition to new structures being built, there's also the building construction to which we're using, whether it's lightweight, whether it's rapid construction, whether it's conventional, whether it's heritage buildings that we've had since like the birth of this city, because those are still beautifully kept, and they're certainly treasures to the community. But to your point, Commissioner, there's a wide range of structural spaces that we're looking at on the fire side, because if there is a fire problem in there, we have to know, because there's a time continuum in that space, right? So pretendability, firefighter safety, the ability to execute rescues and property conservation, the buildings, not only the number, but the heritage and the variation to the construction types are all things that weigh into the statistical reflection of our call volume and the types of calls that we go to. So to that point, we are keeping an eye on that. Certainly, we're constantly looking at statistics, but married to the responses and the future construction of projects, whether small residential or large commercial.
Thank you.
Just want to say I'm always impressed every time you present at the meeting, all the great work you're doing, and all the
Okay,
really
thank you.
innovative ways you're, helping keep Redondo safe. So thank you for all that.
Right on.
I'll ask you a question if I may.
Sir.
I'm always impressed, Chief, that you're able to, without notes, you deliver always. So I just had a quick question because now we're able to access previous minutes. And I wanted to ask you, have we in any cases since we've spoken last used our auto pulse system on anybody? Or have we had a reason to break that thing out?
I've not been privy on my shift. So I mentioned I was a division chief. So there's 3 shifts, A, B, and C. I'm the A shift duty chief. On our shift, we haven't had multiple deployments. In the we've already talked about the close of 2021 and moving into 2022. I will certainly include auto pulse section for each quarter to be able to update you.
Because I know you're awfully proud of that and obtaining it.
Absolutely, yeah. And we just put in 3 new units in service that we discussed last meeting. What I can do is incorporate in the presentation on each meeting as we reflect in our quarterly statistics, that component. But I've not off the top done a look back for the first quarter, but I will kind of round it out. Our next meeting, first and second quarter, we'll round it out comprehensive review for you.
Sure, and thank you very much.
Absolutely.
Thank you for your service.
Are there any other technologies from Zoll or other defibrillator or recovery technologies that are underway, Chief Yang, in terms of conversation and procurement?
The auto pulse really is the latest and greatest, and that's the piece of equipment we're focused on as far as acquisition to equip our fleet to make sure that all the districts in the cities, it's not even just 1 unit per district, but certainly like the redundancy and to be able to repeat the service once one is used and out of service. But right now, the auto pulse is the focus. We're also working on, always working on relationships with the hospitals, the receiving facilities to enhance our 12-lead transmission program, which if you're having, I guess in common terms, a heart attack, we can identify the heart rhythm and then send it to the hospital to activate that cath lab prior to even leaving the scene. So those are elements that we're always looking to seek better ways, more efficient ways, more reliable ways to ensure that that data gets there before the patient. So when we get there, the cath lab, boom, is ready to go. We also are doing things with the hospitals in terms of CVA, stroke management. So LCM and Torrance both have very exceptional stroke programs that we're constantly looking for ways to do better assessments, more accurate assessments, efficient and expeditious ways to get the data to the hospitals. It mirrors the heart attack, myocardial infarction protocols for data transfer to get expeditious and excellent care upon arrival. So there's seamless transition from the field to the clinical setting. So auto pulse technology, Zoll specific, but there are also field elements to that in terms of how we can better do the myocardial infarction and cerebral vascular accident, but also with the Beach Life, it's just being able to streamline our operation. So Beach Life, how do we best provide the care to the patient amongst 10,000 other people listening to great music? There are things that just happen, right? At the Beach Life Festival, we ran 8 calls the first day, 14 calls the second day, 12 calls the next day. And then all in a hyper dynamic space. We've had great partnership with the PD, working together. They're just an exceptional public safety partner. That has been something that has been a gift between public safety, both fire, police, public works has been excellent because we're always in the field together. And then on these events, there's that kind of, again, seamless response, contact, assessment, treatment, and transport to our partners in the clinical setting. There are always things, Commissioner, that I'm glad, I'm excited to share with you about, because I don't necessarily talk about it off the top, but your questions kind of initiate that thought process to share those elements. So many things. It's very exciting.
There's probably a number of PhD theses out there on how to shorten time for a stroke or a heart attack patient. And if we ever uncover anything, any sort of case study that's maybe out of the area that would be good to share,
Absolutely.
Chief Yang would be glad to share maybe prior to the meeting and maybe chew on it a little bit during the meeting. Does
Absolutely.
any other questions, commissioners?
Yeah, you mentioned, Chief, just talking about residential versus commercial when it comes to those issues and disproportionate amounts in the residential sector versus commercial when it comes to reports, and also fireplaces. How do you educate the residents and how to handle and measure and utilize their fireplaces in a more safe and concise manner? I would imagine if you have a public service campaign, very easy to talk about fireplaces in the area and how do we handle your fireplace on a cold winter night? What are things that you can do there? But what are ways in which you've seen that work and how it can better educate citizens in that measure?
So truly the best way is the face-to-face. And being able to place on our website initially, letting the community know that we can come to you and do a scheduled one-on-one. We've been talking to the leadership group over at the high school. So the high school seniors, as well as the underclass persons, they have a committee and a group that goes out and does altruistic work throughout the area. We're talking about teaming up with them for smoke alarm installation in residential spaces. And then with that access, with that program going live, to be able to have those face-to-face interactions, maybe we reach out to first the larger apartment complexes. Maybe we run the Esplanade. Maybe we look towards the north end of town to some of the larger residential apartment buildings that run in the 90278. And then from there, we kind of branch out through the provision of a meaningful service, smoke detector installation or checks, because they are, push the button, get the test. We don't necessarily go out and do fire alarm system testing, but being able to reach out, whether it's like a festival, the internet, the cable channel, whether it's we pursue HOAs, whether we just knock on doors and hand out papers, put flyers out. Those are the ways that it's kind of like a grassroots program, right? You're in a smaller community that you have the ability to reach out on a more intimate level. Commissioner, those are the ways that we would pursue the residential spaces because we have access to the businesses. We know from 8 to 5 or Monday through Friday or maybe Saturday and Sunday, those are folks that their doors are open. We come in, we gently introduce ourselves, and we initiate the contact. To your point, the struggle with the residential space, those are private spaces, right? Personal spaces. So if we can, we're looking at teaming up with, like I said, the first group is that I've interacted with was the leadership group, the seniors and those such, the students, the altruistics that are willing to go out and do the work. So that's the first partnership piece, and then finding the program, smoke detector installation piece, and then moving into it, how to make the flyers touch the doors via hands to doors, internet, whatever we can use. We have an Instagram page for the fire department. So those are advertising ways that we can kind of access to reach out. We can also reach out through our like Wellness Wednesdays with the senior groups, and then kind of go from there, and then reach out to their families as well.
Awesome. Just one follow-up. You mentioned fire detectors. Obviously, are there ways to incentivize citizens to want to utilize or make sure their fire detectors are in proper working order? I remember being a college student and you hear that beep, 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 and you're like, oh man, I don't want any, just turn it off and you kind of throw it away. And yeah, it's okay. And you forget to put it back. I mean, it's kind of a common problem. I see everybody smiling. I mean, we've all had that problem before. Are there ways maybe to incentivize batteries, batteries for fire detectors and can the city support you in any way to help an initiative such as that or anything of the like?
we can absolutely look into partnerships and reach out to Public Works. But actually just this conversation, I know we've had a lot of contacts along Esteban on these very large shared living spaces. We've done disaster prep talks, and they're, big in scope. But then what if we kind of reduced it to a more smaller space of like just the unit space in terms of being able to do risk assessments in the space? Because that's something we're planning on doing with the senior outreach too, is because, the trip hazard element is easily overlooked until when you trip over the element. You're like, I should never have put that there. But so when we go to our older adult beta that we're doing for enhancing a living standard to be able to enhance self-sufficiency and wellness, that's part of that piece as far as risk assessment of the building and of the individual units. Certainly we could do that also with our emergency preparedness talks to HOAs along the Epsilon and then beyond.
Sorry. I think just a theme that, we kind of keep referring to is like, how do we reach the public? Do we have like survey data about in Redondo, how people get news about Redondo? That's a question for anyone. I'm saying like, at least like having, how do people hear about Redondo? Is it like Instagram or whatever? But I think if we had a better knowledge of like what demographics learn, how we can like, all of these intervention, whether it's a path or whatever, really target the population.
Right. Yeah, we will definitely look into that. I know the PD does a great job with outreach and connection. And certainly Kyle may get a nudge after the meeting from a guy with a fire patch on his shoulder for
Maybe
sure.
the newsletter.
Yeah, absolutely.
And then how about the North Redondo Beach Association, the Yacht Club, and the Riviera Village Business Association? Are you all making presentations annually to each of those groups?
Yeah, so we're in the process of linking in the commerce groups.
Yes.
School district, beach cities. We've already made outreaches to the medical offices in the community. Like I've mentioned kind of with repetition since I've been meeting with you, we're reaching out very aggressively to those that would be partners in whatever spaces that we've identified as useful to be able to touch a certain demographic, because either they already have access, because our access, again, is response-based, and that's a fleeting moment. And we provide that service, the moment is captured, that person's taken to the hospital, and we're back at the station. But the goal is to be able to have a perpetual presence where you can call us before the emergency, or maybe we come find you before the emergency. There are elements to being able to reach out to the community proactively. Like I said, our first attempt at this will be Casa de los Amigos, 9 to 11 on May 25th. We're super excited about it. And I am anticipating, even from that meeting with their management, because we've reached out to all the senior living complexes. And I said, well, what if we built a management coalition and we just all got together once a month and we shared with each other, like, this is what our community is experiencing at this location. Wow, that's what we're experiencing too, so that we can create a curriculum that is purposeful, meaningful, and relevant for that group. What if we got with Redondo Beach Unified and partnered with beach cities and talked to the administrators of the district, because they have been incredible partners as well. And whether it's at the district office, at the high school, we're talking about creating a CPR training program for seniors. And I know Captain Kurt Mahoney is working diligently with the high school to be able to get in there and teach that critical life-saving skill that most people talk about, but maybe don't necessarily really know what they're doing. But as long as they can take that positive action and get involved, that's huge. And as far as the fire department being able to provide the training to be able to equip those young folks to go out into the world, wherever they're going to be outside of high school, like how great would that be? And then we expand that to the commerce groups, the district, the students, the faculty, the staff, the administrator. we're building that coalition of community of support and sufficiency, preparedness, training, education, and then here we are.
Preventive maintenance missionaries. It's all good. Go ahead.
Do you think we could ask the council to fund a survey about how people get, news about Redondo so we have just better,
That would be good.
Sure.
Yeah.
so how do can we get, I guess we need data to show why it's worth it and how much it costs and stuff, or how do we go about doing that?
Yeah, that'd be good. We could put that up for just a referral to staff. Do you want to save that for the end of the meeting and then
Okay.
make a referral? Does that, you agree with that, Officer Lostrom? Would that be good? Okay, cool.
Just so, because it'll help you, it'll help the path people, it'll just help everybody if we know exactly where people are getting their news,
But I think, like if I could give a kudos to the police department, I mean, they're out there on the Esplanade, like having coffee with people. They're at the coffee shop. They're like, well, coffee shop's one thing, and people come to us, but they've gone to the people. Like that kind of aggressiveness, and I don't mean that in like a negative way, it's just like, it's the pursuit of the people.
Sure.
And I think those are the kinds of things when we're talking about like post-COVID, kind of going in that direction.
Yeah.
Being able to pursue and reach those who might be isolated, a little shut in, a little bit kind of pushed away from maybe the open interaction. How do we make the connection without being completely intrusive, but reach out and saying, hey, we're here.
Yeah.
And as far as the fire department, we've been working, again, with the partner agencies. Beach Cities has been phenomenal to be able to, through programs, I will say also the city's community services has been an exceptional partner. At Fire Service Day, we had community service come out. They had all kinds of educational components of what their department does, services they provide. We had Beach Cities there. We had the Youth Advisory Council, because strategically we wanted to be able to provide information to, say, younger families and parents of younger kids to prepare them for the challenges of kids growing up. Because the Youth Advisory Council, they're working on a kind of an annual project for student mental health and wellness. And there are so many things that group has kind of worked to provide for information in terms of like worksheets, in terms of recommendations. Because as a dad, I have one going to be a freshman in high school in the fall. And I have one that's in 7th grade now. And if I had known between 4th grade and 7th and 8th grade that these kids would be bombarded with these challenges, I mean, I might be a firefighter, but I mean, I'm also like first-time dad to these kids in these age groups. So being able to have access to people to help me be a better parent with these, like, this is what you should know. This is what's coming your way. Hey, I'm a senior in high school and this is what I'm going through. Like, I wasn't going through that when I was a senior in high school, but it's for the sake of information, equipment. And we see that on the call responses we go to. We see those people that may be distraught, may be upset, may be isolated, they may be coping, and we're able to then turn around and say, you know what, we see this. This is happening in the community. And this is happening with our neighboring agencies, and the hospitals are seeing this, and we're all seeing these things happen. Now, we could just keep going on the calls and just keep going on the calls and or we can do something proactively to help equip people to be better providers to their community, better providers to their families. And if we're seeing it, how can we possibly sit and wait for the tones to go off? Where then we can just say, you know what? We're just going to go first. We're going to reach out to you first, take it or leave it, but here's the information. Here's a resource. Here's the group. Here's a community. If we're not doing that, we are falling down. So that's what we're going to do. And that's what we have been doing.
I think that's just like the best definition of community. That's what we should aim for, I think that's really brilliant.
Sounds like coffee with a cop will now be coffee with a firefighter and a cop.
Yeah.
Pass on information and get market info off that.
Keep that idea right in this room.
I know. I'll let you take all the credit, sir. Is there any other questions for Chief Yang? Chief Yang, you're great. Thank you.
Just wanted to make a comment. I really appreciate and like your line of thought.
Yeah, no, thank you, sir.
Yeah,
All right.
Thanks for all the hard work, as always.
If you have ever any questions, input, ideas, more than happy to hear them. We'd love it. Okay.
Thank you. Thank you very much.
All right, so we can go on to the next one. J3 is discussion of recent events in the city prosecutor's office. Joy Abikin.
Good evening, Commissioners. Joy Abikin, Quality of Life Prosecutor. Nice to meet you all in person. I don't have many updates tonight. Some of you may already know that one of our prosecutors, Anastasia Papadakis, left our office to pursue a new career, but we have recently hired Suzanne Delgin, who started last week as a new prosecutor in our office. Our homeless court last month had 23 participants and 1 graduation. Our next homeless court will be May 25th, next Wednesday. And speaking of last month's homeless court, it was well attended by not only by participants, but also Supervisor Mitchell and Hahn's staff, as well as the Homeless Initiative Chief Executive Office of the county and the South Bay City's Council of Government, and a reporter from Cal Matters. So there are a couple of articles on Cal Matters about Assemblymember Almir Suchi's legislation, AB 2220, which is a pilot program of homeless courts to incentivize other cities in the state to create a homeless court program that has been modeled off ours. So that's what those articles are about.
Joy, what would you say the homeless court provides as a community benefit? Would you say it streamlines some of the rehabilitation and getting people back into society quicker? Or what are your thoughts on the benefits of it?
I could talk forever about the benefits. I mean, we are taking the most resistant, most visible people experiencing homelessness in Redondo, the people who are picking up multiple cases, multiple misdemeanors affecting our residents' quality of lives, and we're helping them. We're getting them services, we're getting them rehabilitated, we're getting them permanently housed. And just to see someone come up to the judge and say, Your Honor, I'm 650 days sober today, when they started with 20 methamphetamine possession cases is just amazing. And we have all these services every month coming to homeless court, and that list is growing, and we're getting more and more services and partners who want to help what we're doing. So the benefits, I mean, there's just too many to name.
And you would say after the homeless court, once they graduate and move on to permanent housing, that they rarely, well, it's been going on for only a certain amount of time, but they don't usually return to the homeless court or come back? Would you say there's?
I have not seen anyone come back to homeless court. I have seen someone relapse.
Yeah.
And go back to the street for one reason or another. Not many. I can name 2 on the top of my head, but it does happen.
2 out of maybe 100.
We've had, yes, I actually have that here. We've had 104 people referred to
Yield
homeless
for,
court.
for resources. Are there other questions by commissioners?
it just shows how much like social support is a factor in addiction and everything.
Yeah. It's really good information.
Thank you.
I just think this whole entire evening so far has been incredible, because when you're part of a Zoom call, you don't necessarily pick up on how the police department, the fire department, the city prosecutor's office, Harbor Interfaith, how we all are tied in together. This is absolutely phenomenal.
Yeah.
I'm glad to be here in person to see this. Thank you for your hard work. And it's great to be a part of something where other communities want to be like us. Thank you.
Yes, and there are cities copying our programs, namely Torrance and Long Beach right now.
That's a big kudos.
Yeah.
Okay, great. Should we close J3 and move on to J4? Discussion of recent law enforcement events, crime recap. Should we pause for a moment?
Waited a really long time for this.
Say
Good
again?
evening.
Yeah, go ahead.
Okay, so there's two things I'd like to cover in the weekly briefing that I included in that section in the agenda. And that's going to be, there was over that time span, 12 stolen vehicles, 7 catalytic converter events. So, and now we're starting to see that being a motivation for vehicle theft. So one of the things that happened last week was, obviously due to the pandemic, the Redondo Beach Police Foundation hadn't been super active in fundraising efforts, stuff like that. But they had a recent fundraising event just prior to Beach Life that was very successful. And one of our detectives was actually able to attend the event, and they're looking to write a grant for what they call like a ALPR camera, if you're familiar with that term. There's license plate reading cameras, and we had equipment that put them on police vehicles. And then there's stationary ones that are placed in certain high traffic intersections in the city. The ones we're looking at that may be available through a foundation grant would actually be mobile ones that we can move in place like where we'd like. So one of our detectives is kind of heading up that effort to write a grant to see if we can get that equipment as another effective tool in identifying the people that are involved in this type of crime via their license plates. Fairly normal, consistent events in property crime, which is our primary crime element in the city of Redondo Beach, as you're aware. Isaac Yang covered quite a bit about Beach Life. We had a great event, and the public safety resources there, the best way to describe it is how he did it was fairly seamless. We had law enforcement personnel and fire personnel on the ground in there. The radio communication was good for having upwards of 12,000 people in the place over the weekend each day. There was no significant safety event incidents. And it was really fun too. I don't know if you guys went.
I heard Weezer from my window. That's pretty awesome.
I don't know if it, or went or heard it.
I heard the volume wasn't actually that loud. Somebody was in row 40 for Steve Miller and they could still have a conversation.
I think the high tide stage, which was that whole venue section is adjacent to Harbor Drive, wasn't quite as loud as the low tide stage, which was the Seaside Lagoon portion, which goes out west. I am not a event organizer or an audiovisual expert, so I couldn't speculate on that. That was noticeable, but I couldn't speculate on the reason.
After spending the past 2 weekends in my world of the Kentucky Derby and the draft in Las Vegas, it was far less impactful to the community, and the volume this year
I don't know how
wasn't discernible at all. And I live in the Villages, and it was perfect.
I'm not hearing very well right now, as it were, just because I was around the speakers for 12 hours a day for 3 days. Is there any questions regarding that information or recent incidents of note? One more I'd like to include is there was a organized retail theft incident where we were able to locate a suspect vehicle and recovered at a location, a residence that the vehicle was found over $5,000 worth of retail, and then obviously investigative follow-up is done to relate those suspects involved to any other potential incidents.
Is that a Galleria retail-based investigation?
Ulta Beauty?
Which one?
Ulta Beauty. So
Okay.
yes, on the property, not in the mall itself, but on that mall prop footprint there on Hawthorne Boulevard. Any other questions?
Yeah, I want to comment about the Beach Life Festival.
Yes.
Let's see, I live near Torrance and PCH, and I can tell you from my experience, it was much calmer and quieter than last time. And so. 'Cause
Great
You
news.
could hear it from where I live, but it was reasonable, I can live with it, there's no problem. And then also, I have a dog and we walk around the area, and I also bicycle to Redondo Beach up to PV, so I pass near there also. And I also ate at Cheesecake Factory, and I can say that everything was very well organized. You did a fantastic job. I'm not going to say it's bad last time, but it's even better now. It's a really good job.
Thank you. I'll take all the credit, actually. The more each time we do an event like this, information is gathered and shared, not only during the event, but after the fact. And it's all with the intent to enhance the next event. So that's how public safety operates. And it's on the fire side too. And that's from a average Joe call police incident that we have where only 3 police officers respond. After the fact, we discuss it. We figure out what could be done better, what was done that time that could use improvement, who can learn from it, et cetera. And that goes all the way up to something like Beach Life. And this is number 3, keep in mind. So I imagine we're getting better at it, and the promoters are getting better at figuring out what works with security and all the different agencies involved that are required to make that a happy, safe event. And we don't just learn from our own stuff too. We're learning from other places and other incidents and noteworthy incidents elsewhere. And if I don't know if you're aware, but there was two shootings in the past couple of days that were deadly. So one was in Orange County and the other one's in Buffalo. So we not only get information from our own learning, but through, tragically, but
Also the Houston concert fiasco with people rushing through.
yeah,
things like
big
that.
stampede in Houston, and that's all taken into consideration and at the forefront of our minds during an event like Beach Life. So, but man, it was awesome. I'll tell you that much right now. Let's end that conversation on a positive note. It's a cool event. Like, I feel proud being the police out there, and it's very cool.
It's great to have a police department that takes residential feedback very seriously. Thank you very much.
Yeah. Any other questions regarding that information?
No questions on that, but I have another question on another topic.
Yes.
I think I read in the crime report about tools being stolen inside the Frontier facility. And I'm wondering, how close is that to the pallet shelter? And is there any, I hate to ask this, but is there any relation to the folks in the pallet shelter and theft in that area? And has that area had any increase in crime near the pallet shelter? Any insights on that?
I'm not aware of that specific, like the details of that specific incident, so I don't know if there's investigative follow-up that would lead the detectives to believe that it was related to the pallet shelter. That sounds like a fairly, just in my personal professional experience, that sounds like that's like a targeted crime incident where you're looking for something that you know is going to be lucrative in nature, which is not, I would say, doesn't typically associate with like a homeless person maybe taking advantage of an opportunity or something like that. That would just be my professional speculation. Obviously, there could have been a car with an obviously organized crew executing that crime or something else.
Sounds like more of a professional job
Yeah,
than a
that's-
homeless person just jumping on an opportunity.
Right.
Gotcha. Okay.
That would just be my speculation, but I'd have to look into the specific incident to know for sure.
Okay.
I would say nothing has statistically been outright different in that area related to the pallet shelter, or surrounding the pallet shelter rather, from like a crime standpoint.
I like the 6 4-way stop signs they have in District 4, but I just want to make sure the District 4 residents are getting a good deal because, there's a little bit of balance in play of pallet shelters and residential safety and as well as commercial safety. Are there any other questions by commissioners? All we're all set?
Sorry, I just because we're going to probably go to the call to action. Do you feel like it would be a worthwhile endeavor to like get a survey of people of how they get news, or do you feel like that's not necessary?
I don't know how relevant my opinion would be on that. We have like a number of tools that access us. We have Comcate system. We have, I field information from our Instagram, our Facebook. We have a number of hotline availabilities out there. We have our traffic hotline complaint. We have an entire unit being formulated right now that's dedicated to quality of life issues that has their own complaint email that I advertise regularly. And although I'm not, my partner, John Bannock, he's done quality of life officer. He's kind of my main partner when I go out and do these engagement type events, which is more my forte. But we're constantly feeding this information out to people, and they're using it regularly. So the people who are seeking it, I think, know how to get it. In regards to professional data harvesting from the city, yeah, I'm sure someone could find some use out of that. I don't know about, I don't know if I have enough professional expertise to speculate any higher than that.
Okay. No, that's all.
Great. If there are no further questions, we can go to J5, discussion of community policing events.
All right. Well, let's just start with the hot topic, coffee with a cop. Okay. We are going to be out there again May 28th on the Esplanade. I did receive recent question about why the Esplanade and what other considerations are being made. And I'll tell you the idea of the Esplanade came into our heads because when I was trying to think of the place in the city with the most people, the Avenue C stairs came to mind on a Saturday morning. So we do have a plan to, this summer, when there's kind of more people out and about, go up to and try the north bike path, because I know that's kind of a well-traveled area with bicyclists and kids and families and stuff, especially now that they'll permit dogs to be allowed in that grassy area surrounding each one. Some of the notable things, we just graduated our Citizens Police Academy class, actually in this room, first one to use the new building, us. So we're going to commence a new session in September. And I highly recommend to all the commissioners to partake. I know you give up one Monday every couple months to be here. It's one night a week, a couple hours, hanging out with me and a bunch of other police officers. And without trying to toot my own horn too much, everyone that went through that class that I did, this was my first one moderating this since I took this position and post-COVID, when we were allowed to do something like this, I felt like had a profound impact on them in way more ways than they expected, in regards to, even if you're a critic in some manners, it will make you a better one. And I'm the one that's going to take the heat on it. So we really encourage you to do that. And I think it would answer just a bunch of questions. And the atmosphere is casual, and you get to talk to people like the panelists you had here, and people like Joyce. And I just really want to push that program out, because I feel like it can do a lot of good, and it's been underutilized. Some stuff we have coming up. We're going to be at the Riviera Village Farmers Market on Sunday, the 22nd. Homeless Court on the 25th. We encourage you to come and watch. That's also a valuable learning experience in practice. Coffee with a Cop, I already mentioned it. Maybe we're going to invite a firefighter to that one. I'm going to just give a little teaser on June 12th. We're looking at community partnership with the Elks Lodge. and bring an empty tummy because we might be serving pancakes. Just throwing that out there. And we're going to be hosting a blood drive here at the library. Another big one that's going to have maybe a larger community impact is our Los Angeles County Police Canine Association, which all of our Redondo canine handlers are members of, and I still serve as the treasurer on that board. They're bringing back their canine show to Redondo High School on July 16th at 1 o'clock. It's 1 to 5. There's a couple hours. They have like a little vendor show where there's a bunch of vendors that come out and have cool, fun stuff for the kids to check out. And then we do like a full 2-hour canine demo with a Bearcat, a helicopter, and we were just getting up and running with a couple shows here in Redondo before the pandemic hit, but we're bringing that back and we're looking forward to a lot of people coming out to that. And you can reach out to me directly if you want some more information on that. And that does it for me in community policing events. Is there any questions regarding any of that stuff I spoke about?
Could you send us information on the class you teach?
Yes. Yes, I can.
You got another student.
That's right. Good. All right.
Let's go to J6, the volunteers and policing report.
Okay. Sorry, 1 second. I actually got 3 months worth of this here. So one thing I want to, it's what you normally see for January, February, and March, since we kind of had a little backup there with that special meeting to cover the hazard mitigation plan. One thing we added was, sorry, I'm trying to find it here. If you'll notice in the April dated memorandum, there's 3 additional categories now for our volunteers in policing, which is cold cases, administrative, and crime analysis. So our crime analysis obviously processes a ton of data, and there's just massive amounts of information to process, and especially with the transition to our new computer-aided dispatch system, Mark 43, which Chief Yang had mentioned. Administrative is more hours assisting kind of our records personnel that are also having to make this large adjustment in the transition to the new system. And then cold cases is a new utilization for them. Typically, sometimes there's old photographs, old documents, or new or otherwise, tons of information that need to be gone through, checked, inspected, filed, stuff like that. And the coordinator for our VIP program, Reserve Officer Mike Stark, was able to find utilization for the VIPs in that realm, which only serves the organization as a whole. And that about does it for that.
Great. Questions from commissioners? All right, well, let's go to the referrals for staff. Commissioner Marinelli, any referrals?
No referrals at this time.
Commissioner Kleinbaum?
I don't have any referrals.
Commissioner Gupta?
Do you guys think that idea of trying to get a survey is worthwhile?
Sure.
Yep. I would also talk to your council person and have a chat with them directly as well.
Okay.
Absolutely.
Okay.
Commissioner Gittens, or Commissioner Gupta, any other referrals?
No, not at this time.
Okay, thank you. Commissioner Gittens?
Just kind of interested in traffic a little bit and just understanding how that has affected you and obviously the Beach Cities program event that occurred this past weekend, which was an amazing smash hit. But just without just the Beach Cities program, kind of what you feel like how traffic is around the area and has that affected policing and everything going forward. And if you think maybe if it is something that we should look into just to understand it better. Just wanted to know kind of maybe your thoughts on that if you had any.
It's the top complaint from our residents in the city, and we pushed that hotline complaint line out. I was in one of the newsletters. If Commissioner Gall is keeping an eye on those, which I know he does.
Yes.
That helps us because then we can know kind of where the issues are. Generally speaking, I brainstorm a lot because I'm trying to figure out how I, as an individual community-based officer, can engage in that effort without going out and ruin everybody's day, writing tickets all day, every day. And really, it starts with kind of a message to people, and a place like the Citizens Police Academy is kind of where I can get that message out, and I'm trying to come up with new ways to get that message out, including ways that I can reach kids, because I don't want to brag or anything, but I feel like my sense of humor reaches all ages. And that message is really kind of like, what can we as a community do to improve the safety in regards to traffic? And just from a personal experience standpoint, I could get in an unmarked vehicle and follow every single person I know around for a short period of time and watch them commit a plethora of traffic violations. And I myself, I have 2 young children that I know are going to drive someday. And I was also a teenager that wanted to look cool in front of my high school friends at some point. And I know that I drove like a jerk. And so keeping my children in mind and kind of modeling after my dad, because I always wondered why he drives so slow. I actively myself try and engage in extremely safe driving to the point where I'm like pissing everybody off around me.
Yeah.
And then I'm thinking to myself like, oh man, I'm being inconsiderate. And then I'm going the speed limit. I'm using my blinker. I'm stopping all the way, actually stopping all the way. Yeah. Right? Not like there's running a stop sign and then there's like kind of stopping. And then it was like, oh, that was really good. But yep, you didn't stop all the way actually. So that's the message I'm kind of trying to deliver, is like, I want everybody to look at themselves and be kind of the leader and the example. Especially when it comes to kids. These kids think it's cool to just drive and text and turn their music up loud and stuff. So when it comes to traffic, yeah, we're going to go out there and enforce. That's one of our biggest complaints. We have our motorcycle officers constantly out there working. We collect money from the state in order to fund shifts, like overtime shifts that are specifically designated to work pedestrian traffic complaints, bicycle traffic complaints, DUI, stuff like that. So yeah, it's an issue, and it's always going to be. And the more people I can get on board kind of with this aspect that I'm working on, hopefully the more change I can do. And that goes in line with, the classic traditional response that law enforcement is going to give you and always has in the past. It's probably worth it, to at least, try and come up with ideas like that can work with me and be kind of an advocate. I would say more so than just banging in complaints on the hotline. We can do that, and we'll continue to do that and provide a high level of service like you're used to. But I would say definitely just kind of being an advocate out there would be huge for us, at least from the angle I work my job in my current position.
No, thank you. And I propose maybe just, providing more advocacy options for you and support, and definitely have my support as far as that effort goes. I have 2 little ones myself, 2 future blossoming public service attendees here on their iPad. So just wanted them to give them an educational opportunity to see all the wonderful people that support our city. But definitely happy to support you there. And maybe we can requisition a study there to help in understanding that from multiple angles, not only the data and statistics, but also just what areas we can target to effectively make traffic safer around our city.
I need to bring my daughter next time as well.
Hey, I'm beating you to the punch, man.
I'm open to ideas. You guys, you see those signs out there like, hey, my kids play here, right? And it's like, even the neighborhood watch groups that we start, like if you send me an email, and if wherever you live doesn't have a neighborhood watch group, start that group. And then it's not, I think everyone shies away because they think it's more labor intensive, but it's really not. You just have to set up one meeting where I can get a hold of as many people as I can in whatever size group we elect is best fit, depending on if there's an apartment involved or a really small street or 2 blocks, if it's really small, or just one big block, whatever. But be that catalyst and start the neighborhood watch group. And then I come out and we get to invite everybody on that street. I'll knock on doors all day. I don't care until I get a hold of somebody and invite them. And you have a meeting where everyone can meet and go, hey, we should. And then all of a sudden you find out everybody would be on board with some speed humps. And now there's some action you can take there that could address the safety on an individual street that directly impacts you or something like that. So there's just tons of stuff, but I'm open to ideas. So feel free to hit me up.
And so how do you start? How do you start? Is it like a formal organization, a neighborhood watch, or what is it?
Yeah, it's literally a program where you can find like the boilerplate information online on our website. If you go to the police part of the redondo.org website, you'll see a whole section on neighborhood watch. If you want to see if you have a neighborhood watch group already in operation that could use like an update meeting, send me an email. If there's not someone there, like we can start it. Okay. So literally just email me and it's on.
So neighborhood watch is a connection between the police and like the actual citizens.
And the block and an individual.
Yeah, I didn't understand
that access. The block captain is kind of that liaison.
Okay, that's cool.
That's how you get the newsletters too.
Great.
Yeah.
Didn't know that.
Yeah.
Just a couple referrals from me. Joy, did you have any more of a need for data discussion with the different agencies, or are you satisfied with the communication you've had this evening?
Any additional communication is always good with all the agencies. So the more communication would be great. Right now, we do feel that is lacking.
I see. Would that be best done in a meeting here with the agencies maybe once in a while, or would you say you can handle that kind of extramurally?
I think the connection we made tonight is a good starting point, and we will definitely build off of that.
Okay, I will try, but not try too hard to, when there's opportunities to kind of bring in that data interchange collaboration element so that you get as much out of the meeting as possible. That was one, and what was the other thing I wanted to mention? Oh, the other deliverable I was going to do is bring a worker training person in from El Camino College and discuss that. If I can invite somebody from PATH or LAHSA back, et cetera, maybe there could be a discussion here, or maybe just a meeting outside of Redondo where they can connect. And I think Dr. Gupta, you had one with the healthcare side and the LAHSA for medical referrals and so forth.
In terms of connecting, well, I mean, I have my organization Optum I could connect PATH with. I mean, that's an interesting idea and I'd like to explore that.
Yeah, it'd be great to find out next meeting what came out of it. I will close with one additional item about the, we were talking about safety data and how our city ranks with property crime and violent crime. And I contacted, was it the city of San Gabriel? And I said, your city jumped 32 points in the rankings. And the city manager's assistant said, wow, we didn't even know this. And, they were really pounding on Santa Monica for being, right there with Compton with property crime and violent crime. But the SafeWise data kind of lumps those two together. And there's a number of people who might disagree, but I would think the folks in Compton don't report all the violent crime that happens in the city of Compton versus Santa Monica. That would be one hypothesis, but I don't think the data that's out there that the media is reporting should bring those two data together to make one ranking. So I guess when Commissioner Hannon is back here, we can continue the conversation to see how we can collect meaningful data to improve the safety of our city. That would be my thought going forward. But without further ado, I'd like to adjourn. Is there any final comments? Are we all good?
I just think a final word and a
Sure.
big thank you from all of us to Officer Kyle Lofstrom from bringing us from the Zoom era
Yes.
into where we're at currently in City Hall and the new renovated
Chief
City Hall
Yang.
chambers.
And
Thank you
the
both
Prosecutor's office.
very much.
I appreciate it. Thank you.
And we are adjourned with my hand gavel at 9:19 PM. All have a great evening.
Thank you.
Thank you.
Good job, buddy.
Proud of you. I hope that's